Have you ever wondered if your body could warn you about a heart attack before it actually happens? Most people believe the answer is no. They imagine a heart attack as something completely sudden. A person is feeling perfectly fine one moment, then collapses the next. While that can certainly happen, medical research has shown that many people experience warning signs hours, days, or even weeks before a heart attack occurs. The problem is that these symptoms are often so subtle that they're dismissed as stress, indigestion, aging, or simply being out of shape. And that may be the biggest mistake of all. What if your body has been trying to get your attention, but you've been explaining every warning sign away? Perhaps you've noticed unusual fatigue. Maybe you've become short of breath while climbing stairs that never used to bother you. Perhaps you've experienced discomfort in your chest but convinced yourself it was just heartburn. Or maybe you've had a strange pain in your shoulder or jaw and never imagined it could have anything to do with your heart. These symptoms don't always mean a heart attack is coming. In fact, many of them can be caused by completely different medical conditions. But that's exactly why they're so dangerous. They're easy to ignore. Many people wait until the pain becomes unbearable before seeking help, only to discover that their heart had been sending warning signals long before the emergency happened. Stay with me until the very end of this video, because the seventh warning sign is the one that surprises both patients and their families the most. Many people feel better after experiencing it, which gives them a false sense of security. Unfortunately, in some cases, that temporary relief can delay life-saving medical care. Before we begin, it's important to understand one thing. Not every heart attack looks the same. Some people experience the classic crushing chest pain shown in movies. Others never feel severe chest pain at all. Women, older adults, and people living with diabetes may experience very different symptoms compared to younger men. That's one reason heart disease remains one of the leading causes of death around the world. Its warning signs aren't always obvious. So how does a heart attack actually happen? Your heart is a powerful muscle that works every second of every day without taking a single break. To keep beating, it needs a constant supply of oxygen-rich blood delivered through the coronary arteries. Over many years, these arteries can gradually become narrowed by fatty deposits known as plaque. Most of the time, this process happens silently. You don't feel plaque building inside your arteries. You don't notice blood flow becoming slightly more restricted. Life continues as normal while your heart quietly works harder to deliver enough oxygen to its muscle. Then one day, a plaque can suddenly rupture. A blood clot forms around it, blocking part, or sometimes all, of the blood flow to the heart muscle. Without oxygen, heart cells begin to die. This is what doctors call a heart attack, or myocardial infarction. The faster blood flow is restored, the more heart muscle can be saved. That's why recognizing possible warning signs early can be so important. Today's video isn't meant to make you fearful every time you feel tired or experience indigestion. One symptom alone does not mean you're having a heart attack. Many of the signs we'll discuss today can also be caused by anxiety, acid reflux, muscle strain, lung conditions, digestive disorders, or many other health problems. The goal of this video is awareness. If you or someone you love experiences symptoms that are severe, sudden, persistent, or occur together, especially chest discomfort, shortness of breath, or pain spreading to the arm, jaw, neck, or back, you should seek emergency medical attention immediately, rather than trying to diagnose the problem yourself. Your heart has been working for you every moment of your life. The least we can do is learn how to recognize when it might be asking for help. So, let's begin with the very first warning sign, one that millions of people mistake for nothing more than simple chest discomfort. The first warning sign is chest pressure, tightness, or discomfort. Notice something very important. I didn't say severe chest pain. That's because one of the biggest misconceptions about heart attacks is that they always begin with unbearable pain. Movies often show someone grabbing their chest, collapsing to the ground, and immediately recognizing they're having a heart attack. Real life is often very different. For many people, the first warning sign is much more subtle. Instead of sharp pain, they describe a feeling of pressure. Others say it feels like someone is sitting on their chest. Some compare it to a heavy weight pressing against the center of their chest. Others describe burning, squeezing, fullness, or tightness that simply doesn't feel normal. Because the sensation isn't always extremely painful, many people don't take it seriously. They assume it's heartburn. Maybe they ate too much dinner. Maybe it's acid reflux. Maybe it's stress from work. Maybe they pulled a muscle while exercising. So they wait. They drink water. They take an antacid. They lie down and hope the discomfort disappears. Sometimes it does. But in some cases, that temporary relief creates a dangerous false sense of security. To understand why this symptom occurs, let's briefly look at what's happening inside the heart. As we discussed earlier, your heart muscle depends on a constant supply of oxygen-rich blood delivered through the coronary arteries. When one of these arteries becomes significantly narrowed or partially blocked, the heart muscle may not receive enough oxygen, especially during physical activity or emotional stress. Doctors call this condition ischemia. During ischemia, the heart begins sending distress signals. One of the most common signals is chest discomfort. Interestingly, your body doesn't always interpret this lack of oxygen as pain. Instead, the brain may perceive it as pressure, heaviness, squeezing, or an uncomfortable sensation that's difficult to describe. That's why so many people struggle to explain exactly what they're feeling. They simply know something doesn't feel right. Another important clue is when the discomfort appears. Perhaps you notice it while climbing stairs, walking uphill, carrying groceries, doing yard work, or even becoming emotionally upset. Then, after resting for a few minutes, the discomfort fades away. Many people assume that because the feeling disappeared, the danger must have passed. Unfortunately, that's not always true. Recurring chest pressure during activity that improves with rest may be a sign that your heart isn't receiving enough blood during increased demand. This can occur with angina, a condition that deserves prompt medical evaluation because it may indicate underlying coronary artery disease. In some people, the discomfort becomes more frequent. It lasts longer, it happens with less activity, or it begins occurring even while sitting quietly. These changes should never be ignored. Now, it's equally important to remember that not every episode of chest discomfort is related to the heart. Acid reflux, muscle strain, anxiety, panic attacks, lung conditions, inflammation of the chest wall, and many digestive disorders can produce similar symptoms. That's why no one should diagnose themselves based on this video. But here's the question you should ask yourself. Is this sensation new? Does it feel different from anything you've experienced before? Does it occur during physical activity? Does it improve when you stop and rest? Is it accompanied by shortness of breath, sweating, nausea, dizziness, or pain spreading to your arm, jaw, neck, or back? If the answer is yes, don't simply assume it's just indigestion. Your heart may be trying to tell you that it's struggling. And when it comes to the heart, every minute matters. The sooner a blocked artery is recognized and treated, the greater the chance of saving healthy heart muscle and preventing permanent damage. Now, let's move on to the second warning sign, one that many people notice long before chest discomfort becomes severe, but often blame on getting older, being out of shape, or simply lacking enough exercise. The second warning sign is shortness of breath. Have you ever climbed a single flight of stairs and suddenly found yourself breathing much harder than usual? Maybe you stopped halfway to catch your breath. Perhaps you blamed it on getting older. Maybe you told yourself you were simply out of shape. Or perhaps you thought, I just need to exercise more. For many people, that's exactly what the cause is. But sometimes, Your lungs aren't the problem at all, your heart is. Most people naturally associate shortness of breath with asthma, pneumonia, allergies, or other lung conditions. Very few people realize that difficulty breathing can also be one of the earliest warning signs that the heart is struggling to pump blood effectively. To understand why, let's briefly look at what happens inside your body. Your heart and lungs work as a team. Every heartbeat pumps oxygen-rich blood from your lungs to the rest of your body. When the heart isn't receiving enough oxygen because one or more coronary arteries have become narrowed, it can't always pump as efficiently as it should. As a result, your muscles receive less oxygen during physical activity. Simple everyday tasks that once felt effortless suddenly become exhausting. Walking across a parking lot, carrying groceries, doing yard work, climbing stairs, even making the bed. Activities you've performed thousands of times may suddenly leave you unusually breathless. Many people don't notice the change immediately because it develops gradually. Instead of thinking, something might be wrong with my heart, they simply slow down. They avoid stairs. They take more breaks. They stop participating in activities they once enjoyed. Little by little, their lifestyle changes without them ever questioning why. In some cases, shortness of breath may even appear while resting. Imagine sitting quietly in your favorite chair, watching television, reading a book, yet feeling as though you can't quite take a deep enough breath. That isn't something you should ignore. Researchers have found that many people, especially women and older adults, may experience shortness of breath as one of the primary warning signs before or during a heart attack. Some people experience very little chest discomfort at all. Instead, breathing becomes increasingly difficult because the heart can no longer keep up with the body's demands. Another clue is when the symptom appears. Ask yourself, does it happen only during heavy exercise, or has it started happening during activities that used to feel easy? Has walking the same distance suddenly become more difficult? Do you become winded while talking, climbing stairs, or carrying light objects? If so, your body may be telling you that something has changed. Of course, it's very important to keep this symptom in perspective. Shortness of breath does not automatically mean you're developing heart disease, asthma, chronic lung disease, anemia, anxiety, obesity, infections, poor physical fitness, and many other medical conditions can all produce similar symptoms. That's why self-diagnosis is never the answer. However, when new or worsening shortness of breath appears together with chest pressure, unusual fatigue, dizziness, nausea, or pain spreading to the arm, jaw, neck, or back, it should be evaluated by a healthcare professional as soon as possible. And if severe shortness of breath develops suddenly, especially with chest discomfort, fainting, or signs of a heart attack, don't wait to see if it improves. Call your local emergency medical services immediately. When it comes to a heart attack, every minute counts. The faster treatment begins, the greater the chance of saving heart muscle and preventing life-threatening complications. Now, let's move on to the third warning sign, one that often surprises people because the pain doesn't always stay in the chest. Sometimes the heart sends its warning signal to an entirely different part of the body. The third warning sign is pain that spreads to the arm, jaw, neck, shoulder, or back. This is one of the most confusing symptoms of a heart attack. Why? Because the pain doesn't always stay where the problem is. Most people expect a heart problem to cause pain directly over the heart, on the left side of the chest. But in reality, the brain doesn't always identify the exact source of pain coming from internal organs. Instead, it can interpret those signals as pain in completely different areas of the body. Doctors call this referred pain. That's why a heart attack can sometimes feel like a problem with your shoulder, your jaw, your neck, or even your upper back. Imagine you're sitting at work or relaxing at home when you notice a dull ache in your left shoulder. You assume you slept in an awkward position. Maybe you spent too much time gardening or lifting something heavy. A few hours later, the discomfort spreads into your left arm. Your first thought probably isn't, "I'm having a heart problem." Instead, you blame a pulled muscle or a pinched nerve. The same thing happens with jaw pain. Many people think they have a dental problem. They schedule a dentist appointment because the pain seems to be coming from their lower jaw. Others feel discomfort in their neck or between their shoulder blades and assume it's poor posture or arthritis. Sometimes they're right, but sometimes those symptoms are actually coming from the heart. Researchers have found that pain radiating into the left arm is one of the classic warning signs of a heart attack. However, it's important to know that the pain doesn't always follow the textbook description. Some people feel it in the right arm, some feel it in both arms. Others experience discomfort mainly in the jaw, neck, shoulders, or upper back without severe chest pain. This is especially important for women, older adults, and people with diabetes, who may experience less typical heart attack symptoms. So why does this happen? Your heart and these parts of your body share some of the same nerve pathways. When the heart muscle is deprived of oxygen, the brain can misinterpret the distress signals, making you feel pain somewhere other than the heart itself. This is one reason heart attacks are sometimes mistaken for muscle injuries, arthritis, acid reflux, or even tooth problems. But here's something you should pay close attention to. Heart-related pain often doesn't improve when you change positions. Stretching usually doesn't make it disappear. Massaging the area doesn't solve the problem. Instead, the discomfort may gradually become more intense, spread to additional areas, or occur together with chest pressure, shortness of breath, nausea, sweating, or dizziness. Those combinations of symptoms should never be ignored. Now, it's equally important to remember that pain in the arm, jaw, neck, or back does not automatically mean you're having a heart attack. Muscle strains, arthritis, nerve compression, rotator cuff injuries, cervical spine problems, and many other conditions are far more common causes of pain in these areas. That's why context matters. If this type of pain is new, unusual, unexplained, or appears alongside other possible heart attack symptoms, especially during physical activity or emotional stress, it deserves prompt medical attention. And if the pain is severe, persistent, or accompanied by chest pressure, difficulty breathing, or fainting, don't drive yourself to the hospital. Call emergency medical services immediately. Acting quickly can save heart muscle, and it can save lives. Now, let's move on to the fourth warning sign, one that many people mistake for food poisoning, the flu, or simply having an upset stomach, when in reality, it may be your heart sending an urgent cry for help. The fourth warning sign is cold sweating, nausea, and unexplained dizziness. Imagine you're sitting quietly at home. You haven't been exercising. The room isn't hot. Yet suddenly your forehead becomes covered with cold sweat. Your shirt feels damp. Your hands become clammy. At the same time, your stomach starts feeling unsettled. You feel slightly nauseated. Your head becomes light. For a moment, you wonder if you're about to faint. Most people don't immediately think about their heart. Instead, they assume they caught a stomach virus. Maybe it was something they ate. Maybe their blood sugar is low. Maybe they're just dehydrated. While those are certainly possible explanations, these symptoms can also be important warning signs of a heart attack, especially when they appear together with chest discomfort, shortness of breath, pain spreading to the arm or jaw, or unusual fatigue. So why can a heart problem make you feel sick to your stomach? When the heart suddenly receives less oxygen because of a blocked coronary artery, the body reacts by activating the nervous system. Stress hormones such as adrenaline are released into the bloodstream. These hormones prepare the body for an emergency, but they can also trigger cold sweating, nausea, vomiting, weakness, and dizziness. At the same time, if the heart isn't pumping blood effectively, the brain may temporarily receive less oxygen-rich blood. This can leave you feeling lightheaded, unsteady, or as though you're about to pass out. Many heart attack survivors later describe these symptoms by saying, "I just didn't feel right." They couldn't explain exactly what was happening. They simply knew something felt different. That vague feeling should never be ignored. One important fact that surprises many people is that women are often more likely than men to experience nausea, vomiting, dizziness, or unexplained sweating during a heart attack instead of the classic crushing chest pain. Older adults and people with diabetes may also have less typical symptoms, making diagnosis more difficult. This is why paying attention to the combination of symptoms is so important. Cold sweating by itself may simply be caused by anxiety. Nausea alone may be caused by food poisoning. Dizziness can result from dehydration, low blood pressure, inner ear disorders, or many other medical conditions. But when several of these symptoms appear together, especially with chest pressure, shortness of breath, or pain radiating to the arm, jaw, neck, or back, they should be treated as a medical emergency until proven otherwise. Ask yourself a few honest questions. Have you ever suddenly broken into a cold sweat without any obvious reason? Have you recently experienced unexplained nausea along with chest discomfort? Have you ever felt so dizzy that you needed to sit down immediately, even though you weren't exercising? If these symptoms occur together, don't simply wait to see if they disappear. When it comes to a possible heart attack, delaying treatment can allow more heart muscle to become permanently damaged. The sooner emergency treatment begins, the greater the chance of restoring blood flow and protecting the heart. Remember, your body often sends several warning signals at the same time. The challenge is recognizing them before it's too late. Now, let's move on to the fifth warning sign, one that many people dismiss as nothing more than getting older or being overworked, even though it can begin days or even weeks before a heart attack in some individuals. The fifth warning sign is unusual or overwhelming fatigue. Everyone feels tired sometimes. A busy work schedule, poor sleep, stress, or taking care of your family can leave anyone feeling exhausted. Normally, after a good night's sleep or a relaxing weekend, your energy gradually returns. But the type of fatigue we're talking about today is completely different. This isn't simply feeling sleepy. It's a deep, overwhelming exhaustion that seems completely out of proportion to what you've been doing. Imagine waking up after 8 hours of sleep, yet you still feel as though you haven't rested at all. You struggle to get out of bed. Walking from one room to another feels like hard work. Simple chores that once took only a few minutes suddenly leave you needing to sit down and recover. Many people blame these changes on age. I'm getting older. I've been working too hard. I probably just need a vacation. And sometimes that's exactly the reason. But in some people, especially women, unusual fatigue can appear days or even weeks before a heart attack. Researchers have found that many patients later remembered feeling an unexplained lack of energy long before they experienced chest pain or other classic symptoms. So why does this happen? Your heart is responsible for pumping oxygen-rich blood to every organ, muscle, and tissue in your body. When the heart begins struggling because its own blood supply is reduced, it may no longer deliver oxygen as efficiently as your body needs. As a result, everyday activities require much more effort. Your muscles tire more quickly. Your brain feels sluggish. Even routine tasks become exhausting because your body isn't receiving the oxygen it requires to function at its best. This fatigue often develops gradually. 1 week, you stop taking your evening walk because you're too tired. A few days later, climbing stairs becomes more difficult. Soon, even carrying groceries or making the bed feels unusually exhausting. Because the changes happen little by little, many people simply adjust their lifestyle instead of asking why their energy has changed so dramatically. Another clue is that this fatigue often doesn't improve with rest. You sleep, you wake up, and you still feel drained. That's very different from normal tiredness after a long day. Now, it's important to remember that fatigue is one of the most common symptoms in medicine. Anemia, thyroid disease, depression, poor sleep, infections, diabetes, vitamin deficiencies, chronic stress, certain medications, and many other conditions can all cause persistent exhaustion. That's why fatigue alone does not mean you're about to have a heart attack. However, when unusual fatigue appears together with chest pressure, shortness of breath, cold sweating, dizziness, nausea, or pain spreading to the arm, jaw, neck, or back, it becomes much more concerning. Take a moment and think about your own body. Have you recently become exhausted by activities that never used to bother you? Do you feel completely drained even after a full night's sleep? Have friends or family noticed that you've slowed down without any obvious explanation? Sometimes your body doesn't shout that something is wrong. Sometimes it simply whispers. By making everyday life feel harder than it should. Listening to those whispers may help you recognize a serious problem before it becomes a medical emergency. Now let's move on to the 6th warning sign, one that many people describe as their heart fluttering, racing, or skipping beats. A symptom that's often ignored until it's accompanied by something much more serious. The 6th warning sign is an irregular heartbeat or heart palpitations. Have you ever been sitting quietly, not exercising, not feeling particularly stressed, and suddenly your heart begins beating differently? Maybe it feels as though it's racing. Maybe it skips a beat. Maybe it flutters for a few seconds before returning to normal. For many people, this happens once in a while and is completely harmless. Too much caffeine, emotional stress, poor sleep, certain medications, even dehydration can temporarily change the rhythm of your heartbeat. But sometimes an irregular heartbeat is your heart's way of telling you that something much more serious is happening. Many people describe palpitations in different ways. It felt like my heart was pounding. My chest was fluttering. It felt like my heart stopped for a second. My heartbeat suddenly became very fast. Others don't notice the heartbeat itself. Instead, they feel dizzy, weak, lightheaded, or as though they might faint. So what causes this? Your heart doesn't beat randomly. Every heartbeat is controlled by a highly organized electrical system that tells the heart muscle exactly when to contract and relax. Under normal conditions, this electrical system keeps your heartbeat steady and efficient. However, when the heart muscle isn't receiving enough oxygen because of reduced blood flow, those electrical signals can sometimes become unstable. This may trigger abnormal heart rhythms known as arrhythmias. Some arrhythmias are harmless. Others can become dangerous, especially if they occur during or shortly before a heart attack. An irregular rhythm may reduce the heart's ability to pump blood effectively, leaving less oxygen available for the brain and the rest of the body. That's why some people experience dizziness, weakness, blurred vision, or even sudden fainting, together with heart palpitations. Another important clue is when the symptom appears. Does your heart suddenly race while you're simply watching television? Does it begin fluttering during light physical activity that never caused problems before? Does it happen together with chest pressure, shortness of breath, cold sweating, nausea, or pain spreading to your arm or jaw? If the answer is yes, it deserves prompt medical attention. Now, it's very important to keep this symptom in perspective. Most palpitations are not caused by an impending heart attack. Caffeine, nicotine, alcohol, anxiety, panic attacks, thyroid disorders, electrolyte imbalances, certain medications, and many harmless rhythm changes can all cause your heart to beat differently. That's why no one should diagnose themselves based on this symptom alone. But here's what should never be ignored. If an irregular heartbeat is new, persistent, associated with chest discomfort, causes fainting, or leaves you feeling severely short of breath, you should seek medical evaluation immediately. When these symptoms occur together, they may indicate that your heart is under significant stress. Remember, your heart's rhythm is like the engine of a car. If the engine suddenly begins misfiring while warning lights are flashing on the dashboard, you wouldn't simply keep driving and hope everything fixes itself. Your body deserves the same attention. Sometimes acting quickly can prevent a temporary rhythm problem from becoming a life-threatening emergency. Now, we've reached the seventh and final warning sign, and this may be the most dangerous of them all, because unlike the other symptoms we've discussed today, this one often tricks people into believing they're actually getting better. The seventh and final warning sign is symptoms that come and go. This may be the most dangerous warning sign in today's video, not because it's the most painful, but because it's the one most people ignore. Imagine this. You're walking through a grocery store when you suddenly feel pressure in your chest. Your breathing becomes slightly harder. A dull ache begins spreading into your left arm. You stop walking for a few minutes, and slowly, the discomfort disappears. Immediately, you feel relieved. You tell yourself, it must have been indigestion. Maybe I overworked myself. I'm feeling fine now. So you continue with your day as if nothing happened. That decision has unfortunately delayed life-saving treatment for many people. One of the biggest misconceptions about heart attacks is that the symptoms must be constant from beginning to end. In reality, some warning signs can come and go. The discomfort may last only a few minutes. Then it disappears. A few hours later, or even the next day, it returns. Sometimes it's stronger. Sometimes it's exactly the same. This pattern should never be ignored. In many cases, symptoms that appear during physical activity and improve with rest may be caused by angina, which occurs when the heart muscle isn't receiving enough oxygen-rich blood. Stable angina often follows a predictable pattern, but when symptoms become more frequent, happen with less activity, last longer than usual, or begin occurring even at rest, it may indicate unstable angina, a medical emergency that can occur before a heart attack. Think of it this way. Imagine the main water pipe supplying your home is almost completely blocked. Most of the time, enough water still gets through. But whenever everyone in the house turns on the shower, washing machine, and kitchen faucet at the same time, the pressure suddenly drops. When the demand decreases, the water seems normal again. That doesn't mean the pipe has been repaired. The blockage is still there. Your heart can behave in a very similar way. When your body demands more oxygen during exercise, emotional stress, or even climbing stairs, a narrowed coronary artery may not be able to deliver enough blood to the heart muscle. The warning signs appear. When you rest, the heart needs less oxygen, so the symptoms improve, but the underlying problem hasn't disappeared. It's simply waiting for the next moment your heart has to work harder. That's why temporary relief should never create a false sense of security. Now, it's equally important to remember that symptoms that come and go don't automatically mean you're about to have a heart attack. Acid reflux, muscle strain, anxiety, panic attacks, and many other medical conditions can also produce intermittent discomfort. The difference is the overall pattern. If episodes become more frequent, more intense, last longer, or occur together with chest pressure, shortness of breath, cold sweating, nausea, dizziness, or pain spreading to the arm, jaw, neck, or back, don't ignore them. And if chest discomfort lasts more than a few minutes, returns repeatedly, or is accompanied by severe symptoms, call your local emergency medical services immediately rather than waiting to see if it passes. Minutes matter. Every minute without blood flow means more heart muscle can be permanently damaged. The encouraging news is that modern emergency treatments can often restore blood flow quickly when patients seek help without delay. Recognizing these warning signs early may save not only your heart, but your life. Now let's bring everything together and review what these 7 warning signs really mean, and what you should do if you've experienced one or more of them. Now, let's bring everything together. Today, we've explored 7 warning signs that may appear before a heart attack in some people: chest pressure or tightness, shortness of breath, pain spreading to the arm, jaw, neck, shoulder, or back, cold sweating, nausea, and unexplained dizziness, extreme fatigue that doesn't seem to improve with rest, irregular heartbeats or heart palpitations, and finally, symptoms that come and go. The warning sign that can create the most dangerous false sense of security. If you've recognized one of these symptoms in yourself, don't panic. And if you've experienced several of them, don't immediately assume you're about to have a heart attack. That's not the purpose of this video. The goal is awareness, not fear. Every symptom we've discussed today can have many possible causes. Chest discomfort may come from acid reflux or muscle strain. Shortness of breath can result from asthma, anemia, or lung disease. Fatigue may be caused by poor sleep, stress, thyroid disorders, or vitamin deficiencies. Heart palpitations are often harmless and can be triggered by caffeine, dehydration, or anxiety. That's why self-diagnosis is never the right answer. Only a qualified healthcare professional can determine the true cause of your symptoms through a proper medical history, physical examination, blood tests, an electrocardiogram, ECG, imaging studies, and other diagnostic tests when necessary. But there's one thing that every cardiologist agrees on. When it comes to a possible heart attack, time is muscle. Every minute that a blocked coronary artery remains closed, part of the heart muscle is deprived of oxygen. The longer treatment is delayed, the greater the risk of permanent heart damage, heart failure, dangerous heart rhythms, or even sudden cardiac death. The good news is that modern emergency treatments have saved millions of lives. If blood flow is restored quickly, doctors can often limit heart muscle damage and significantly improve long-term recovery. That's why recognizing warning signs early is so important. Fortunately, there are also many proven ways to lower your risk of heart disease over time. Stay physically active. Choose a heart-healthy eating pattern rich in vegetables, fruits, whole grains, beans, nuts, fish, and healthy fats. Avoid smoking and tobacco products. Maintain a healthy body weight. Control high blood pressure, diabetes, and high cholesterol. Get enough quality sleep. Manage chronic stress in healthy ways. And most importantly, never ignore new or unusual symptoms that your body is trying to show you. Your heart has been beating faithfully since before you were born. It works every minute, every hour, every day, without asking for a single break. Taking care of it may be one of the most important investments you'll ever make. Now, I'd like to hear from you. Which of these 7 warning signs surprised you the most? Was it the chest pressure, the shortness of breath, the pain spreading to the jaw or arm, the cold sweating, the overwhelming fatigue, the irregular heartbeat, or the symptoms that come and go? Leave your answer in the comments below. I read every comment, and your suggestions help shape future evidence-based videos on this channel. If you found this video valuable, please consider sharing it with someone you care about, a parent, your spouse, a close friend, or anyone over the age of 50. One simple conversation could encourage someone to seek medical care before it's too late. And if you enjoy science-based health content explained in a clear, practical, and easy-to-understand way, Be sure to subscribe to Vital Secrets Health for more videos on heart health, healthy aging, nutrition, disease prevention, and long-term wellness. Before we finish, one important reminder: this video is intended for educational and informational purposes only. It should not be considered medical advice, diagnosis, or treatment. Every person's health is different, and symptoms can have many possible causes. If you experience severe chest pain, difficulty breathing, fainting, or other symptoms that may indicate a medical emergency, seek immediate emergency medical care without delay. Thank you for spending your valuable time with us today. Take care of your heart, because every heartbeat is a gift. Stay healthy, stay informed, and I'll see you in the next video on Vital Secrets Health.